Hello everyone. Today we are talking about diabetes. You know, it is very interesting because I did my dissertation, my doctorate, I did my dissertation on diabetes. So I wrote a lot of papers on diabetes, a lot of papers on diabetes. But today we are just looking at diabetes and how it affects us as a Black community, but also as individuals. Diabetic is a metabolic disorder affecting the body's metabolism of carbohydrates. That's why it is called a carbohydrate disease, because it basically affects it is a carbohydrate disease, affects how carbohydrate is metabolized in the body. So we have diabetes, as most of you know. We have diabetes type 1 and type 2. Type 1 mostly, remember, it used to be called juvenile diabetes, where usually it started at an early age, but nowadays type 1 diabetes can also start later in age. Mostly it used to start early in age, but now it can start later too. It is the type 1 diabetes is where somebody has always to use insulin. You can't use tablets. You have to use insulin. So that is basically that is type 1. Also, it is where the beta cells in the isolates of Langerhans are destroyed. So that is why that there is no way out. Your body is going to rejuvenate so that it can produce its own insulin. So while type 2 is progressive decreased production of insulin. So type 2, it is not like quickly, it takes time, it's progressive. And people can have type 2 diabetes, and they can use both insulin and they can use both tablets, while somebody on type 1 diabetes can only use insulin. So that is very important. But what I'm going to discuss today is how do you manage your diabetes, and what are the complications of diabetes? Why is it necessary for you as a person watching this video, as you subscribe to my YouTube channel, Dr. PAM OBARE MoGKA, and as you share this to your friends? Why is it so important, it's so necessary for you to control your diabetes? For me, I say the reason why you should control your diabetes is because of the complications of diabetes. But before we go to the complication, what are the signs and symptoms of diabetes? Most people present the signs as urinating so much, being very thirsty, wanting to drink water, and wanting to eat. Polyuria, polydipsia, polyargia. They want to urinate so much. So those are the 3 signs and symptoms. Sometimes people somebody used to be fat, they lose weight all of a sudden drastically. They don't have cancer, but they are losing weight. So it is good to check those people to see if they have diabetes. But we have diagnostics that check, and we take patients' blood and check what they call Hemoglobin A1c. That looks at your sugar for the last 3 months, and they see how you average. Sometimes people say, I don't eat a lot of sugar, a lot of simple carbohydrates. Simple carbohydrates are like sugar, white flour, pre-shifted stuff. So people say, I don't do that. But when you look at the A1c, you realize that these people have been eating all that, because A1c goes high. So the normal A1c should be anything between 5.7 and below, and anything that is 6.5 that is diabetes. 6.4, we say they are pre-diabetic. But basically, if it moves a little bit higher, you have diabetes or you are diabetic. Also, we do a fasting glucose sugar. Anything that is over 100 or over to 125, anything that is higher, that person is diagnosed as having diabetes. There are other recommendations, a 2-hour glucose check. Also, if a patient has anything that is over 6.4%, then also they are diagnosed with diabetes. So that is just that. So that is when we actually the 2-hour plasma glucose, which is greater than 200. Sorry about that. So that is when we diagnose people with diabetes. So then what are the risk factors? The risk factors are family history. Diabetes is could be genetic, it's genetic. Family history. If your mother has diabetes, your father has diabetes, your brothers, you could inherit it. So you really didn't do anything about it. The other thing is obesity, meaning you're overweight, you're not controlling your weight. That can bring to diabetes. The other thing is sedentary lifestyle, eating foods that are not recommended, high starch, high carbohydrate food, simple starch food. That can also cause you to have a high blood, to have high sugar. The other thing is mostly it affects African Americans, Hispanics. They're affected with type 2 diabetes or diabetes. Also, mothers who have had a history of gestational diabetes, or who have had a child who is over 9 pounds or 10 pounds. Not everybody, but those are the risk factors that people will develop insulin resistance syndrome. So those are the few risk factors I've said: family history, obesity, eating unhealthy food, being African American or Hispanic, history of gestational diabetes, or having an infant who is over 9 pounds. So what are the complications? For me, complications are things that really scare me, because complications of diabetes can really, really, really decrease somebody's quality of life. For example, one of the complications can be divided to micro complications, which are tiny ones, and macro, which are bigger. So micro complications include retinopathy, meaning your retina gets clogged and you can't see. Basically, you become blind. You've seen people become blind, and usually in Africa, they say, oh, this person has been bewitched. There's no bewitching. It is the diabetes that has bewitched you. The other thing is nephropathy, where the kidneys are damaged. That's basically what it is. The other thing is neuropathy, where people have, especially to lower extremities like your feet, sometimes your hand, you have something they call tingling and numbness, where you feel like pins are breaking you from there. Sometimes you don't actually have sensation down there. That's why you see somebody who has diabetes, sometimes when they get hurt at their lower extremity, it is very hard for them to get well, because the blood flowing doesn't go very well to the lower extremities, so the blood doesn't flow so well, so the healing process is slower. That's why there's amputation. When somebody is, if they don't heal well, they might end up having amputation. Macro include atherosclerosis, so hardening of the arteries. We have heart diseases, coronary artery diseases. Those are the macro complications. So the target organs are the eyes, the kidneys, the peripheral nerves. And as I said, complications could be very, very frustrating. Renal failure, that's why you hear people go for dialysis, because their kidneys can't function. The kidneys are the filters. If they are not filtering, hey, you will end up going for dialysis because it has to filter. If it's not filtering, you're dying. So other things, as I said, the complications are like amputation. So what can we do to prevent these complications? What we can do to prevent the complication is that we take responsibility. If you have diabetes, you need to take responsibility. Until you start taking responsibility of your disease, you start managing it, you start learning about it, you start knowing what is diabetes, what foods am I supposed to eat, when am I supposed to go for my eye exam, when am I supposed to go for my kidney, for my kidney, when am I supposed to go to see an endocrinologist, because they're the ones who study more, who are more educated about diseases that deal with diabetes. When am I going to see a foot doctor? Because foot doctors can check. If you go every 3 months, they check, they see how your feet is doing, they assess you. If you have any wounds, they take care of them. Also, very, very important, because it is a carbohydrate disease, you want to know what foods are good for you, especially carbohydrate foods. Simple starch, simple sugars are not good for you. So you want to eat complex starch. People come from Africa. The finger millet, that is one of the best because it has complex carbohydrates. Complex meaning it doesn't get digested quickly so that the sugar levels go up. It takes time, so it balances your sugar in the body. It takes time to balance the sugar. So that is why it is important to eat foods. If you have to eat carbohydrates, you have to eat foods with high fiber, foods which are whole food. That include, as I said, finger millet. If you have to eat oatmeal, that are complex carbohydrates that takes time to be digested in your digestive system. Very, very important. Also, you need to know your numbers. What is your A1c? When every time you go to the doctor, ask, what is my A1c? And what is the best, what ranges should I be? And then if you have to be on medication, if you are going to be on insulin, you have to know what kind of insulin you have. Because we have insulin that is short-acting insulin, intermediate short-acting insulin, actually fast-acting insulin, short-acting insulin, we have intermittent insulin, we have long-acting insulin. You have to learn about all those insulins because you can actually kill yourself if you don't know what insulin you are going to use at what time and what time. We also have something they call sliding scale, where when you check your sugar, you also have to know how to check your sugar by yourself. Sometimes you have that bracelet that says that I'm diabetic. If, God forbid, you go into a diabetic ketoacidosis or diabetic coma, somebody will save your life because they can give you, either they can give you insulin or they can give you glucose. If you go to a diabetic coma, they can give you glucose. If your sugar is so high, they can give you insulin. So it is good for people to know, or even the paramedics to know what kind of complications you have, or if you have diabetes. Very, very important. So once you do that, once you take personal responsibility to know about your diabetes, you know, my late ex-father-in-law, really, I appreciated him because he knew his numbers. He knew what to eat. That man did not have any complication of diabetes until he died at age, I think, 80. He never had any complication of diabetes. He knew he will travel with his flask of milk. He will travel with his finger millet, ugali, they call it. He would travel with it, you know, the cooked cake, African cake. He will travel with it because he knew what to eat and what not to eat. When you take responsibility, don't leave responsibility to your doctor. And when the doctor realizes that you know about your disease, they would also be willing to help you. So know about that. And also every 6 months, you're going to your podiatrist. Twice a year, you're checking your A1c, or even 3 times. You are asking your doctor, how are my kidney functions? How are they doing? You know, you just have to check. You always have to ask, how are we doing? How are we doing? Did you check my sugar? How is it? How is also the medication? Is it helping you? We also give ACE inhibitors. Some medications are called ACE inhibitors to prevent kidney damage. And also we check some blood work that checks all those liver functions, kidney functions, all those. You also have to control your lipids, meaning your like the fats in the body, because also we have to check that. So diabetes is I just call it it has to be taken between the patient and the providers. You have to have that mutual understanding, discussing about it. Sometimes, like us providers, we have so many people, we see so many patients. So it's going to be your responsibility. Hey, Dr. Pam, I'm coming today. Let's check this. Oh, did you check, doctor? Did you check my A1c? How am I doing? You are going to take responsibility, because sometimes doctors can't remember. They can't even remember your name. Because even a day I see over 50 people. I can't remember when you come 3 months later. I can't remember you, because after you have seen so many. I can't remember your papers. I might remember your face or your name, but I might not remember all the diagnoses that you have. Unless, like if you keep engaging the doctor, then, they will remember. So that is very, very important. Always check your feet. Always check your feet and make sure. And also ask your doctor to check your microalbumin levels, to check what it is, and see if you are at the same level, at a good level, because that is what is the precursor to check for renal failure. And also, as I said, your insulins, if you have to be on insulin, you have to know them. Just don't give yourself insulin because you're giving yourself insulin. Because some insulins, like Lantus, is a long-acting insulin. It stays 24 hours. It works slowly. So if you're giving yourself Lantus, you have to know that it's going to act slowly. And then let's say, for example, you're giving yourself a short-acting like Humulin. It's going to act, it has like a 1 hour period that it starts to act. And there are some that act like rapid Humulog, that acts within less than 30 minutes is starting acting. That is why you have to know that you cannot inject yourself with insulin until you have food ready. Your food is there, you're eating. You see what I'm saying? So it is educating yourself, giving yourself that knowledge. It is going to help you. Thank you. Thank you so much. And keep sharing. Diabetes has so much. Even, like it has so much that I just touched just a little bits here and there. But for me, I truly think that if you have to manage your diabetes as a person, if you are affected by diabetes, if you are the one who has diabetes, you have to take your time, study, learn, read about it, get pamphlets about it. Ask your doctor. Actually, they can refer you to a nutritionist. If you have good insurance, they refer you to a nutritionist who is going to help you, teach you how to eat, what kind of food to eat, and that is going to help you. I hope you enjoyed. This is Dr. Pam. Subscribe to my YouTube channel. I appreciate you. Leave for me a comment too, guys. If there's something I missed, because, I can't remember everything, just comment down there. Say something. Say something down there. If I missed something, comment. I'm going to read your comments. And subscribe to my YouTube channel. Share with your friends. Let's support each other as a community. Let's educate each other. Let's give each other information that is going to help us. Diabetes can be very, very managed, very well managed, especially type 2 diabetes. You don't have to suffer. If you know, you know. You don't have to suffer. Thank you and be blessed. Dr. Pam.